So Together We're Better is a partnership of local NHS organisations, including groups of general practices, the local hospital, the community provider, and also, importantly, the local authority and council services as well that are involved in healthcare. We feel as though we can provide a much more coherent and holistic service to patients by working together. It's increasingly obvious that the determinants of health are much wider than the NHS can offer, so it's really important that we work with our partners in social care, in the voluntary sector, to do a more holistic job. Community and primary care are really important, and they're quite often seen as the bedrock of the NHS and often the first port of call for many patients coming in to the health system. The demographics of society is changing. People are living longer. We have a high percentage of older people, and it's really important that NHS services change to keep up with that need and demand. The only way we can do that is by listening to patients and the public. What is it that they need from their NHS? What is it that they need from their GP services, from their community services? And it's really important that we start to listen to what matters to people rather than asking them what the matter is with them. So the sorts of things we want to hear about and understand are what sort of pressures do people have when they're trying to access their doctors, what sort of services do they feel that they need, what sort of services are missing. We really want to understand what it's like to use the NHS from a patient and a citizen point of view, and that's sometimes difficult to do when you're working within the NHS, so it's really important to get an outside view in, and then for us to listen to that and change accordingly. I would really like people to get involved in this listening exercise because it's really important that the solution that we come up with is fit for purpose, and it's only going to be fit for purpose if we understand and ask people what they really want. There is no one solution, and it's really important that what we do is suitable and reliable and appropriate for a range of different people. So we want as many different views as possible.